Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Losartan. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing to discuss in this presentation is what Losartan is used for. So Losartan treats high blood pressure. It reduces the risk of stroke in patients with high blood pressure and an enlarged heart. It treats kidney disease in patients with diabetes. We'll now discuss how to use Losartan. So first off, take your medicine as directed. Your dose may need to change several times to find what works best for you. Drink plenty of fluid if you exercise, sweat more than usual, or have diarrhea or vomiting. And read and follow the patient instructions that come with this medication. Talk to your doctor or pharmacist if you have any questions. So what happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, skip the missed dose and take the regular dose at the regular time. Never take extra medication to make up for a missed dose. Store this medication in a closed container at room temperature, away from heat, moisture, and direct light. We'll now discuss some warnings associated with Losartan. So it is not safe to take this medication during pregnancy. It could harm an unborn baby. So tell your doctor right away if you become pregnant. This medication can lower your blood pressure too much, especially when you first use it or if you are dehydrated. So stand or sit up slowly if you feel lightheaded or dizzy. Tell your doctor if you are breastfeeding or if you have kidney disease, liver disease, congestive heart failure, or diabetes. Also tell your doctor if you have angioedema that was caused by blood pressure medication. Your doctor will check progress and effects of the medication at regular visits, so be sure to keep all your appointments. We'll now discuss some side effects or adverse events. In these cases, if you were to experience any of these, you would want to get in touch with a physician right away. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, if there is a change in how much or how often you urinate, if there's confusion, weakness, an uneven heartbeat, trouble breathing, numbness or tingling in your hands or feet or lips, if you have lightheadedness, dizziness or fainting, or rapid weight gain, swelling in your hands or ankles. Alright everybody, that's all we're going to talk about today with Losartan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.